Board of County Commissioners workshop on the American Rescue Plan. We could rise for the invocation, or the pledge, not the invocation. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you. I will turn this over to our county manager.
Thank you, Mr. Chair.
My pleasure.
Commissioners, this afternoon we'd like to talk with you about the American Rescue Plan Act. As you know, an additional $149.5 million or so has been allocated to Lee County, and the guidelines for spending are really quite specific and can be complicated, but we're gonna go through this as simply as we can to talk with you about the categories that of spending that we would like to recommend to you and the amount of dollars in each of the categories. And when we're finished, we'd like to, if you agree, that's great. If there's some things you want to change, that's good too. But this is the time for us to have that conversation. So I'm going to ask Mr. Salyer to present the American Rescue Plan Act, and he wrote the whole thing. So go get him, Glenn.
All right, thank you, Roger. Good afternoon, Commissioners. If I may, at the outset, I do want to just take a quick moment to thank everyone who contributed to this presentation. Like all of your pandemic relief efforts, it really has touched every department, county attorney's office, pretty much every aspect of the organization that I can think of. And at the risk of diminishing people's contributions, I certainly want to single out the performance management team for their work on this to date, Jennifer Posey and Benjamin Small. So thanks though to everyone in the audience in particular. So as Roger mentioned, we are going to give you an overview of the American Rescue Plan Act. Promise to try to keep it fairly simple. After that, we'll move into a timeline that depicts where we've been thus far and where we are headed with this. After that, we'll move into some specific Phase 1 recommendations, and we are calling it Phase 1 because even with the plan that we're presenting today, there still are significant funds to program in the future. Then we'll talk about some next steps in terms of following board direction after you've had a chance to think about and discuss what we talk here today. Okay, this first slide is really intended to show the different funding streams under the American Rescue Plan Act. It's $1.9 trillion, so we won't go through each of these categories. Suffice it to say, there are many different programs provided by the federal government, and it's a jigsaw puzzle when we're trying to figure out how to best use these funds so as to not duplicate efforts, number one, and to leverage resources that are available to us, number two. Drilling down to what is happening locally, we do have the $149.7 million that is a direct allocation of ARPA monies. And then in the text box there, you can see what the local municipalities are slated to receive. The Estero number probably jumps out a little bit. In talking to the officials there, they were a little surprised by the magnitude of that number, and they think it's largely based on their the budget that they had passed most recently. And then that takes us to pandemic COVID relief efforts writ large. Just to put all of this in context, a reminder that we have received different funding streams prior to this, the CARES Act being the primary one, $170 million in total almost. Right now, we are administering a $23 million emergency rental assistance program. This provides rental payments, water, sewer payments, and electrical payments for qualified renters. That effort has been underway since March, and we've distributed almost 45% of the funds available at this point. So it's an ongoing effort. And then, of course, in the final column, we do have the American Rescue Plan Act, not only the direct allocation of $149 million, but the other tranches of funding there as well. And of course, that puts us at a grand total of just over $377 million. If you include the money that was made available to the Port Authority, which you also oversee, this number gets even significantly larger than that. And please stop me along the way with any questions. We'll take them as they come. Eligible use categories, this is how the Act lays out the categories, if you will. I'm not going to spend a lot of time on these because they are such large and overarching categories: public health, negative economic impacts, premium pay for essential workers, infrastructure investments in water, sewer, and broadband, and then something that's called revenue loss or revenue replacement. And we will talk about all of these in more detail as we go along. This provides some of that detail. These are the allowable expenditure categories. What it does is it breaks those 4 eligible use areas down into something a little more concrete. We're providing this slide so that you can see some examples of the types of expenditures that would be allowed under the Act. It isn't that we are necessarily proposing all of these, we're not, but when you're thinking about future programming, we wanted you to have these examples by way of illustration so that you could consider these types of programs. We need to talk about ineligible uses. I'll just read through them: pension fund, tax reduction, general infrastructure projects. So if it doesn't fall within the categories of water, sewer, broadband, it would only be allowable if it falls into the revenue replacement category, or it provides some pandemic-specific relief, meaning you're making facility modifications to protect people from the virus, or you're making healthcare type modifications to facilities to serve people who have been infected. And then the last category is debt service, replenishing reserve funds, paying legal settlements or judgments. None of those are permitted. We want to show you the reporting dates that are relevant here, simply to sort of detail the amount of information that the county will be providing to the community and the federal government as we move through implementation. It's a lot of reporting, as you can imagine, all of these federal grant programs, lots of compliance involved. I think this is also a good place to mention some very relevant dates that are of significant importance here. These monies have to be obligated no later than the end of calendar year 2024. We then have 2 more years in which to wrap up the actual work and make the actual disbursements or payments. So that takes us to the end of calendar year 2026. But again, the monies themselves have to be completely obligated by the end of 2024. Some other requirements that we just want to touch on: community engagement. That is required, of course, by the Act and something you would do anyway and have done. Thus far, we've published a dedicated Rescue Plan Act webpage that shows our work on this to date. And the next bullet there says, I'm sorry, go down 2 more. It says web-based community survey for negative economic impacts. This is something that we are recommending that we undertake as a county, and we would make it part of that dedicated web page as well as disseminate it through the newsletter and other means. But what we found is most communities are satisfying this public engagement piece in part by conducting a community-wide survey, and we certainly would recommend doing the same. Now, already we've engaged directly with many of our partner agencies, a lot of our constituent customers through the various departments. We've utilized your human services gap analysis, and generally speaking have taken input from some of the advisory committees as well. So we've been collecting information all through the pandemic, really, about the impacts of COVID-19, the needs of the community, and potential options for addressing those needs, and we'll continue to do that. And then finally, the last bullet under community engagement says proposal solicitations for human services related projects, and that ties in directly to a proposal that we will talk about in just a few minutes, whereby we would solicit specific proposals from service delivery agencies. The other two things I want to mention are equity-focused program design and evidence-based or research-focused program delivery. For public health expenditures, negative economic impact expenditures, and programs for disproportionately affected communities, we do need to make an equity analysis to make sure that we ensure a fair distribution of the funds. And we also need to make sure that the programs we fund are either using evidence-based programs or they have a research-focused delivery model that will allow us to assess the outcomes and their effectiveness at program end. Any questions about any of that? Okay. I'll move on then and show you this timeline that shows the U.S. Treasury issued the interim final rule in May. The comment period closed in July, and I would just note that the final rule, if you will, has not yet been published. We don't expect that it would contract the allowable uses for these money, but it could potentially expand some of the expenditure categories. So we'll let you know as soon as that rule is finally issued. So in the interim, we of course have been assessing this community input that we just talked about. We've been generating potential project ideas, vetting them for eligibility under the Act, and generally trying to assess whether or not we would recommend these expenditures to you, and that will be the next part of the presentation. We've also created report templates that we will use going forward to satisfy our obligations under the Act, and we have already submitted those to the U.S. Treasury. And so, that takes us to September, where we are today, this presentation, and we would anticipate that to be followed by your specific direction and approval of some of these programs, and we would expect that that would continue then on a rolling basis. This is going to be a fairly long-lived program, lots of resources involved. Certainly we'll need to adjust as we go along, and so we would certainly anticipate that you provide ongoing feedback and approvals. Want to show also the November 1st quarterly expenditure report. Remains to be seen whether we'll have any expenditures by that time to report or not, but we'll be filing that regardless if it says zero or we do have program expenditures. And then pointing out that at the end of the calendar year 2021, under the Act, we have an opportunity to calculate whether or not we've lost any revenues up to that point. And if we have, you're able to then use those lost revenues for general government services. Again, we'll talk about more of that in a minute, but just want to point out here that that is a calculation you make at the end of each calendar year through 2024. And then finally, we have on there February strategic planning, just suggesting that you could provide more input at that opportunity, again, as well as anywhere else along the way that makes sense. So that takes us to the Phase 1 recommendations, and here we'll talk about some very specific programs that we are recommending to you today. I'm going to ask the different assistant county managers to help out with this piece. And we're going to start with public health. Here we have $18 million currently allocated for the category as a whole. And we would start with the workers' compensation piece with Chris Brady, please.
Thank you, Glenn. This $2 million represents a placeholder to help cover workers' compensation costs for our EMS employees as it's related to COVID. It's, again, just a placeholder. That number may need to be adjusted up or adjusted down, but as we move forward with these issues, we'll continue to look at that number.
Okay, thank you. And I'm going to ask Mark Moore to talk about the next two categories, but before I do, I just want to point out that all of you have a spreadsheet depicting these program recommendations. Some of the folks in the audience do as well. This is posted on our website for anyone who wants to drill down into these recommendations. And so with that, Mark, if you wouldn't mind.
Yes, thank you, Glenn. Before I start, just want to acknowledge the work of our Human Services team in partnership with Performance Management on these particular proposals. The first one here we're highlighting is basically aiming at building capacity with our local mental and behavioral health agencies, particularly to address youth behavioral services, Baker Acts in particular. Just to give you a snippet of information to kind of frame the context of the challenges we have currently. During the first 6 months of 2019, in the first 6 months of 2020, we had a 28% increase over the last months in 2019. In the first 4 months of 2021, in comparison to 2020, there was a 460% increase. So there's been a dramatic increase for Youth Baker Act services. In April, just another snippet of information, April 2020, 32 youth were Baker Acted. In April 2021, 94 youth were Baker Acted. So obviously an implication of COVID on some of these numbers. There are currently few available pediatric crisis stabilization beds within 100 miles of Galasanos Children's Hospital due to staffing shortages and just high turnover rates. Working with our partner Lee Health, there's an anticipation that this trend will continue over the next 2 to 3 years. And I just want to let you know, this is not an issue that we're seeing just here in Lee County. This is an issue that we're facing nationally. So some of the proposed activities under this particular item, funding for existing youth crisis stabilization units or CSU behavioral health providers to ensure that there's adequate staffing and a return to full capacity. Funding for any behavioral health providers to incentivize the expansion of CSU capacity to meet increasing demand. We are looking to see funds being made available through a competitive notice of funding availability process in engagement with a nonprofit partner through a subrecipient contract. Any questions on this particular proposal before I move to the next one?
Mr. Chair, if I could dive into that, I mean, do they have any idea what's driving the increased Baker Act? And so a Baker Act is where you're taken into custody because you're a danger to yourself or others, right? And so that there's been a 400% increase in kids who have been taken into custody because they were a danger to themselves or others throughout this pandemic. So clearly we're seeing the societal cost of pandemic restrictions and even just being in a global pandemic. But what's driving it? Is there any way to understand what's driving it?
You know, I wish I could hit at the root causes of all of this. Certainly, we have partners that have studied and looked at this. Salis Care, our partners, are here this afternoon, so they might be able to provide a different lens on it. But certainly, we're assuming that the pandemic has kind of highlighted the issues with youths and resulted in these increased Baker Acts.
Is there a way that we can use some of our dollars to help with counseling, with some way to maybe prevent kids from getting to the Baker Act stage? Are there services that we can support, I guess, with some of these dollars?
I'm assuming there are, and I think when we go through this notice of funding availability and we kind of structure the response we'd like to see from nonprofits, that's something we could include. So they'll be submitting plans to us. We outline what the expectations are, and then we award the money. So I think that's something we can build into the ask of the nonprofits. Certainly sounds like something that could mitigate the number of Baker Acts, and I think that goes hand in hand with the proposal that we'd be putting on the street.
Okay. Thanks, Mr. Chair.
Commissioner?
Mr. Hamlin, regarding your question, I've always asked some of the people in the business and over the last year about the number increases, and it's a kind of a lot of it comes from control with children. We all know if you have children, you have to put structure in place. So we had, before last year, we had lockdowns, shutdowns. Kids were home. They weren't home before. Parental issues, struggling, being a 14-year-old told you have to stay home, you can't go to school, you got to wear a mask, you don't wear a mask. And picture being 14 and told you you're going to get sick and die, or your liberties will be taken away from you. So I think a lot of it's been a lot of depression for the children and confusion. And a lot of times they're actually in different homes. One home they'll go to 1 week and they're told not to wear masks. The other home says you don't have to wear a mask. So a lot of imbalance, I guess, is what I was told by a lot of the counselors of the kids with structure at home. So they really don't know what to do. And kids like to learn. They learn in groups, and when they're home, sit at home, being forced to sit home, not go to school, it causes a lot of issues.
Certainly can attribute it to the disruption, particularly at home as well as school, with a lot of people going to a homeschool model.
Well, and this might be a chance for me to say it. I haven't weighed into a lot of that, and I'm not going to, get into another board's business. But I will say, as a parent, one of the things I am disappointed in is we keep saying, this is only going to be for 30 days. Whatever new measure it is that we want to adopt to put on our kids as a pandemic restriction, oh, it's only going to be for 30 more days. Guys, this is the third school year you're screwing up. I mean, really, when you think about it, in March of 2020, you sent our kids home at spring break and then didn't teach them basically the rest of the year. They never set foot back in the school building for the rest of that year. Last year, they wore masks all year, and their education was disrupted because our poor teachers, who are doing an amazing job, had to be the mask police. And now this year, here we are again with another year worth of restrictions as a third school year. That's not 30 days, that's long term now. You're getting into 3 school years. And so I hope that if there's anything we could do to help support our youth and our children with some of these dollars, I would like to support that myself.
I believe the latent impact that the pandemic has on our children is reflective in Lee Health's estimate that we'll see these pediatric Baker Acts continue on for 2 to 3 years. And I'm sure that's the basis of some of their estimation.
Okay, thanks.
Hey, Mark, go ahead, Commissioner, sorry.
You know, when we talk about Baker Act for youth, what age group does that encompass?
I believe these are 18 and younger are considered pediatric, and correct me if I'm wrong, Roger. Yes.
Are we seeing similar numbers for adults?
We are, actually, and we're going to get into another proposal that addresses Baker Acts in general. Yes, sir.
Okay, thank you.
Can I digress for a minute?
Certainly.
Okay, great. So Glenn, maybe just to put this back up at the 100,000-foot level, which I think is probably most appropriate, and I think all the comments are great, but what drove us getting together was a report that was due? Was there an initial report that was need to be filed with the receipt of the first $74 million?
Yes, sir, we
Okay.
did file.
So, and in that report, we had to come up with certain categories. We have multiple years. When's the deadline to utilize all the funds? 24?
They have to be obligated by the end of calendar year 2024.
Okay. So we have more or less 3 years to go through this process. And I appreciate the fact that we have major categories, which are appropriate. I think the evolution of each category as we go further into this, I just really want to try to start to go from the 100-foot level down to the 50,000-foot level to down into the details, because I think there's so many things we don't know at the moment to try to allocate this. I mean, the other thing is that we're receipt of 1 check. Okay, we haven't received the 2nd check. And I think as we look at and measure, and as 5 county commissioners start to hear from our community, I think we can certainly say then maybe we need more money in public health, or maybe we need more money in another particular area. And I'm just only concerned, this is just my 2 cents, and my 4 other commissioners may think but I'm just trying to kind of stay at broad categories, just because we're so premature and this legislation is still pretty in its infancy stages in not really being as defined as we'd like it to be. And I would suspect, and this is not trying to put you on the spot, although I'm probably going to, is if we didn't have a report to file, we may not be sitting down having this meeting. Is that a fair statement?
Well, we certainly wanted to engage in this planning effort with you, and keeping it as high level as you like is perfectly fine, because as we'll talk about in next steps, implementation clearly is one of those. So we just need to get your broad stroke policy guidance so that we then can come back to you with actual implementation details. Yes.
Yeah, I think the great categories you've selected, and obviously as part of the act, are super. I think to try to now divide that allocation, or because we might, as Chris started off the meeting, I really was going to start to bombard her with workers' comp, because we might need twice the amount of money in that category. We don't know, because it's always evolving. And as that evolution comes through is how we're going to allocate dollars and cents. And this is, I mean, we're dealing with the after effects of a pandemic that we don't really even know what we're dealing with at the moment with great clarity. I'm not saying we don't understand what's going on at the moment, but I think as this really comes to a head, we'll start to have a much greater appreciation for where we're going to utilize the money to the best of our ability in the most specific categories. That's just in my head.
Mr. Chair?
Sure.
Commissioners, thanks for helping us get there, Mr. Chair, just a little bit. Commissioner, if you would, think about this spending much like you would the general fund, for example, where you provide us policy direction, after which we bring back recommendations. So what we've done today is we wanted to bring you the sort of the rules of engagement, and it's very easy for all of us to jump into, well, how are we going to spend this $149 million right away? But the truth is, this is going to be a bit of an evolutionary process as we go along to really put this money to its best use, and to talk too much today about too much detail. I don't think we're capable of helping you through that conversation yet. I mean, what I've heard so far, if I were going to convert it to a policy statement, is you all have an interest in making sure we've got money for youth and mental health. So to go beyond that, I think would be very difficult today, but that becomes one of the messages for us that's clear and helps us then come back to you at a later date in the process with very specific recommendations. Hey, Glenn, did I get that right?
Yes, sir. That is perfectly on point. And, to that end, I don't know if Mark, if you need to go into the next program or not, because I think the county manager stated it well. It's if it's a broad policy decision that we put these monies in these allocations, then we'll come back with program details.
Commissioners, I have to tell you, we struggled with this presentation. We've been through it several times, and as I'm hearing it today with a little bit different ears than when the last time we went through it last week, and it's easy to see how we've led you down a path to a little more detail than we probably have time for today, or to at least enough time to give it proper consideration, given everything we're dealing with. So we're happy to Glenn, I think let's go through the presentation just as we have designed it. But commissioners, just with that in mind, if that will work for you.
Okay, very good. So the Community Behavioral Health Services, that's another program where we would solicit proposals from service providers in the community. And then finally, the COVID-19 mitigation and response measures. I'll just tell you that we do know there are Melvin Morgan Constitutional Complex facility modifications underway that will qualify for these monies because they help protect against the spread of the virus. That takes us to negative economic impacts. I think the category is pretty self-explanatory. We would propose funding the food banks much like you did during the CARES Act cycle. We've thrown out the number of $5 million as being commensurate with what you did during the previous COVID assistance. Workforce training, we're suggesting that vocational certification programs, EMT training, things that are very specific to getting and we can use all of the providers that you would expect: Florida, Southwestern, FGCU, CareerSource, et cetera. On the small business assistance side, we would propose a modest program there to allow the EDO to provide technical assistance to businesses throughout the county, as well as some rental assistance to companies that have a physical location in a qualified census tract. I'm mentioning that detail because, as we talked about previously, within these categories, we do have to do an equity analysis, show a fair distribution of program dollars, and one way of doing that is by providing services within qualified census tracts. And then finally, the hospitality industry, like you discussed this morning, it has been very resilient. However, that resiliency has been uneven. We have small operators that are still hurting. We have some real challenges in the international space. And so we're suggesting some funding to help address those particular needs. Moving to disproportionately impacted communities, just say here that between extended learning programs, homelessness outreach, child care assistance, and nonprofit human services, We are suggesting a fairly large concentration in this category. The homelessness outreach and the child care assistance, these are programs that you've been engaged in all along, and to some extent replicate what you've done through the CARES Act funding previously. We probably should talk about the large program here that we're talking about for, we've said 20 million, but obviously that's open to your direction. This would be we envision this as a partnership with the United Way that would do two things. One, it would help the United Way create capacity to provide technical assistance to grant recipients. By technical assistance, we mean everything from fiscal controls, managerial training, staff training, whatever they might need to be able to build capacity to take on this kind of funding. And then secondly, clearly to put service delivery on the street through the partner agencies themselves. For the infrastructure category, we've got a number of potential projects outlined here. They fall in the category of water quality, flood mitigation, or stormwater management, flood mitigation, utility, water, drinking water treatment, as well as some cybersecurity for LCU, and we are suggesting doing an in-depth study of broadband availability throughout our community so that if there are gaps in terms of download speeds and people being able to get online to either find a job or go back to school or for their kids to be distance learning, we can come up with ways to better address those. Thank you. Yeah, so Pete is pointing out that Pine Manor water lines, we estimate that cost at $3 million, not $43 million. So your total category there is 41, but again, that's just a starting point for discussion. Moving to revenue replacement, this is a category that's unique. Here you take your previous 3-year growth average and you project what your revenues would be if you maintain that growth. Wherever you fall short of that, you can make up those differences through this revenue replacement. And what the calculation says is that Lee County has available $27.8 million in this category. Now, the reason this is important is you have broad flexibility to use these dollars in just about any way that you otherwise would to provide general government services. So while the other categories are very restrictive, this one is pretty broad. You still can't service debt, pay off legal settlements or judgments, or bolster your financial reserves, but outside of that, you do have a lot of latitude. And so the broad allocations that we've suggested here as a starting point for your discussion, you can see the total there. I think the important thing to emphasize is that even with those allocations, you still, if you wanted to follow all of those, you would still have $42 million available for programming in the future. Lots of flexibility, and as Roger had mentioned previously, there's going to be a lot of adjustment throughout the 3 years of this program. So however you allocate these, we will be continuously monitoring, clawing back where we need to, reprogramming, and we'll be coming back to you quite regularly with those actions. That takes us to next steps.
Before you go on, please.
Yes, sir.
Commissioners, would you back to the previous slide, please? So, Commissioners, these numbers that you see, think of those as placeholders with some proportionality to them. We think proportionally, given the total number of dollars available, we think that's about how they ought to be apportioned. But again, I don't think I can say it enough that all subject to change as we continue on and we go through our next steps of really understanding the community needs and the kind of policy direction you want to give to us in order to meet those needs.
Okay, so as we do move into next steps, again, we're recommending that we implement a community-wide survey to collect additional input about needs that are existing, as well as potential ways to address them. We anticipate bringing some version of action to you for your direction in a regularly scheduled board meeting, whatever direction you want to provide to us to get the implementation started. As we've mentioned, there's ongoing reporting, and you will see that regularly, at least every quarter. Phase 2 plan formulation, that is to be determined based on everything that the chair just talked about in terms of emerging needs as we continue to navigate this pandemic. And then, of course, what we've been emphasizing here in the last few minutes, which is continuous and ongoing Rescue Plan Act plan modification. And that is it for the presentation. So we'll try to answer any questions.
So Glenn, it kind of just sticks in my head through this, and first and foremost, I can't thank the staff enough for all you've done during these challenging times. But I want to, continue in my briefings, continue to make sure we explore every potential option in that premium pay, whatever we can do. Been some really trying times, and if there's an opportunity to become creative, at least from my point of view, I'd like us to see what opportunities there might be, because thank you all for all you've done this year. I don't even know how to quantify, and really even thank you just isn't enough. So if there's anything we can do, I'd like to understand that premium pay aspect. I've heard a lot of different variations throughout the state. I think there's just so much ambiguity associated with what that means and what you have the ability to do. But I'm just a big believer you invest in people. And people, without people, we don't have an organization.
Yes, sir. Did you want me to respond with the?
I just want to, I know it's to be determined. I mean, we don't get an opportunity to talk as 5 commissioners. Not just my 2 cents. I wanted it on the record. I certainly want to just indicate that. I know everyone would give proclamation today. There's many ways you can thank people, and I think each commissioner thinks the world of the staff, the way they've performed, what they've done, and there's all different stories and what people are trying to do throughout the municipalities. I'm still very much engaged, different opportunities, and I think the jury's still out on what you can and can't do. I just want to make sure in all the different categories, it's these people that make it happen. And to me, if there's anything that we can do from a creativity, I at least want to have a dialogue amongst us.
Yes, sir. Understood. Just the broad strokes are you can provide a per hour adder, if you will, for essential employees. There are some ways to get creative about who you designate as essential. And then the other thing to keep in mind is the Act does require that you prioritize lower paid workers. So there are different ways, of course, you can do that as well.
Just the rise in the Delta, I look at my own company, and so many people probably could have made more money staying home and chose to stay with our company, and I appreciate that. And I have a lot more flexibility in the private sector than you do in public government, but I can't say thank you enough.
Thank you.
Thank you. Yes, sir.
Commissioner?
Yeah, the public health, I don't think anybody believed we would be in this place today, this year, but we had most of this behind us. And you look at a lot of different areas, as the chairman said. I empathize a lot with our healthcare providers. They are working, burning in at both ends. And I think we looked at costs in a variety of different ways, but I think from what I understand, for the hospitals themselves, to get people, to hire people, to maintain people, it's a cost that is just, I don't know how you continue to manage that. So I hope in the course of looking at this whole thing that we do consideration there, that they're pretty special people. They're running to the fire every day.
They do, and the staff. I reflect back. I don't think I was through the primary 2 days, and I asked Roger if I could sit down and have a broad-based conversation with many of the staff people, and what role could we potentially play in this pandemic? And at that point in time, probably not much. But that's probably not it. And I'll always remember him calling me that Sunday after Christmas saying, Mr. Chairman, can you come down to the EOC? We need to sit down and start going through logistics. We're going to do mass vaccinations. I mean, just the roles that we're in, no one ever dreamed we were doing that. And honestly, you know, it might have been a rough couple of weeks, and God, everyone wanted to burn us at the stake. But thereafter, I mean, we ran like the most efficient entity I've ever seen around. And again, we're going through a Delta now, and I understand all the pressure that's going on, but, you know, we also responded. You know, we're good enough to have a relationship with the governor, have an antibody clinic. We responded again to reopen up testing at you know, Century. You know, and again, we tried to do and be as proactive as we could. We took some pretty aggressive measures internally to make sure we were trying to participate, giving more people the option to stay, and try to do everything we could on our end. You know, today in the meeting, more than 80% people had masks on. I mean, again, we're trying to do everything we can do, and it's just another way of gratitude. But reflecting back last August to a year now, I never thought I'd be sitting here talking so much about the pandemic and how it's affected and our role. And I commend each and every one of staff that played a part, from the sheriffs all the way through. You know, something I never thought I would do in my lifetime. So, thank you.
Thanks, sir. So, Commissioners, as we've gone through the presentation today, and I'm back at an earlier slide on expenditure categories, public health, negative economic impacts, service to disproportionately impacted communities, premium pay, infrastructure, revenue replacement, and administration. Are there any of those areas that you'd like to talk generally about today that you think we may want to maybe more or less emphasis than we have placed on it today, as you've given all this some thought since our briefings last week? Sir.
The only one that stood out on the infrastructure piece was compared to the other numbers, the broadband feasibility study, and I realize it's just a study, was pretty marginal. I mean, I don't know where this is going as far as working remotely for us, for students, so on and so forth.
Right.
So I think the availability of broadband to more people faster is important. So I'd like to see us address that. Really, it's only a study, but I'll make sure we get the money behind it.
Thank you. Commissioner Hammond, you were mentioning earlier community mental health.
Yeah, I guess my thought, and you know, apologize if I get too specific, but
No, it's really okay.
yeah, my thought is, you know, this is an opportunity for us to hit on a couple things that we don't traditionally have an opportunity to hit on, and that would definitely be mental health, especially if our children need the help to recover from this. You know, I know kids are resilient, but, you know, certainly if there's anything we can do to help them get through this time and prevent what we're seeing there. But also, when you look at the community mental health, look, I believe there are folks in our community who we've helped throughout the last year, some of them who may never be able to truly sustain themselves and become, you know, the fully productive members of society that we all want them to be because of maybe a disability or something like that. And so for those folks who maybe won't be able to sustain themselves, then it is on us as a humane and civilized society to reach out and help them with supportive care or living somehow. And so as a policy or a broad area to look at is how could we help that group? And, you know, I really appreciate the programs that we have that give people that hand up, that help those people who truly can do it get back on their feet and get into housing and get into jobs and get into everything. We have some amazing programs for that. I think maybe an area of opportunity to grow would be, so for the folks that we know probably aren't going to be able to sustain themselves through mental health or some disability, you know, if instead of letting them sleep in the woods, you know, if there's something we could do to help them, I think that's a humane and good thing to do.
Public health seems a little light, to your point, Commissioner Hammond. I do look at the dollars and cents, and I mean, I know this is a fluid situation, but I couldn't agree with what you were saying earlier. I just think that we're going to shift money as things come out. And when I heard that statistic in my briefing of the increase, I was just overwhelmed, and I'm just like, wow, you know. And I don't know what 6 months looks like or a year from now looks like. And that's why I like the fluidness of this. But, you know, the one page that just stuck out in everything that I was looking at is just the whole reporting. I don't know what page it was on. Reports due, and it starts August 31st, 2021, and it just goes to 27. I was just like, I mean, there's a lot of information we're going to, yeah, there it is. I mean, you look at that, and this is an evolution that's going to have some of us not even sitting here. You know, it's going to 27. I mean, you know, you're going to have to be here for at least 2 terms to see this whole thing come together.
We're paying for it for the next 50 years, though. $370
That's a whole different conversation. I'm happy that we're in the position we are, and I can't be appreciative of what you all have done. It's great to be part of your team, so.
Commissioners, any other thoughts on those expenditure categories? Not today?
Roger, I'd like to jump in with one clarification, just to say that between the public health categories and the disproportionately impacted communities categories, a lot of the program ideas that we've proffered today can go under either category. So, you know, just know that if you move the $20 million program, if we went with that, that could easily be reported under public health. It can go either way.
Sir?
I have one more. On the eligible use categories, investments in water, sewer, and broadband. I mentioned broadband.
Oh, broadband, yeah.
Okay. One of the challenges we have looking forward is septic to sewer. And we talked about this briefly in some of the initial meetings and that kind of stuff. I don't know how that plays out. It's a big ticket for a lot of people. If there's monies that could be used in some form or fashion going forward to help mitigate costs to individuals, I think would be well received and a need.
I agree 100% with what Commissioner Sandelli just shared there on that. You know, we certainly each of us in our districts have communities that it would be a huge financial hardship to expand those utilities like that, but we know there's a need to do it. So if there's an opportunity here, I think it'd be a good time to take it.
Yes, sir. Commissioners, I think in that too distant future, we're getting closer to identifying some potential projects for the septic to sewer or septic to other technology. And most of those areas that we're looking at really are not the very affluent sections of town, of Lee County. And I'll just go to some of our original studies, which talk about the amount of raw sewage just about that's making its way into the river from some of those septic tanks along the north shore of the river. And you're looking in and amongst those communities, those are, I think by anyone's measure, economically depressed communities, but yet those are the areas that we really need to get to first. And so for those folks who cannot afford the hookup fees, for example, hopefully we can use some of this money to help supplant those costs.
I think the other thing is, as the chairman said before, probably time to get creative. I think we think in terms of what always was septic to sewer. There's some new technology, so I know you're aware.
Right.
That might be interim pieces in certain areas that allow us to move quicker.
A lot to digest. I think you did a great job on the first pass, and I'm sure we'll have a lot more to say as this evolves. Thank you.
Good. Thank you, Commissioners.
Nothing else, I'll call for adjournment. Thank you all.